Good afternoon, YouTube. Thank you for joining me today. Recently, I've come across this article in the National Post. Scientists estimate more than 75,000 people could be infected in Wuhan. 75,800 to be exact, could be infected in Wuhan as of January 25th. 75,800 people in Wuhan may have been infected, according to their model. This could be accurate, this could be inaccurate. It's all, I don't know for sure if this particular model has any credibility. But first, a little bit of information on coronavirus itself. Here is the electron microscope picture of it. It's named corona for its distinctive, let's call it, they're not exactly ears, but say the little pieces here protruding like a crown. Essentially, what we know is that this virus can be contained within a host for an incubation period of up to 2 weeks, and that person doesn't have to exhibit the symptoms, but they can be infectious and contagious. So it's a little bit troubling. Essentially, what I learned from the H1N1 is there's no cause for fear. You would take necessary precautions to protect yourself and your family. I hear about isolation and that kind of thing in the extreme circumstances. You can use the antibacterial cream. I suppose you could use a dozen number of things. Gloves, perhaps. Avoid skin-to-skin contact and proximity with people on the street or your colleagues. People are wearing masks. I have a little clip here to show you quickly about that, so just bear with me.
These N95 respirators are flying off store shelves. Do I need one to protect myself from coronavirus?
So I would say no. So these N95 respirators that we're talking about, these are used as respiratory protection in very specific circumstances in healthcare. And there are a couple of reasons for that. They're pretty tight fitting. They have to be actually fitted on individuals. So it's not like there's one size fits all. In fact, here's another example of a very similar looking product, but for a larger face that maybe is shaped differently. And so healthcare providers need to go through a whole process of making sure that you can get a good seal of this around the face for it to be effective.
What about these types of masks? I've seen a lot of people with these types of masks around.
Yeah, so these are procedures or surgical masks, definitely something that we find is effective for interrupting transmission to healthcare workers who, again, are going to be providing close face-to-face care with infected patients.
But not the public?
Not the public. We will sometimes ask patients or visitors who are coming into the hospital who are coughing and sneezing and such, we will ask them to put on a mask in order to prevent them from contaminating their environment or potentially transmitting to other people around them.
So if they're sick.
Right.
So that, in that case, a mask works. If you're sick and you don't want other people to get sick.
Exactly.
Would you wear a mask if you were in a crowded place right now in Canada?
I would not. We are not seeing this as something that is commonly circulating, this novel coronavirus, in our population. And like I had mentioned earlier, we really don't have evidence that having everybody in public wearing these masks would actually do anything to protect the public. And it can have these collateral harms, like, you start touching it and manipulating it and touching your face, and potentially actually putting yourself at greater risk. So if people are walking around wearing masks, even these loose-fitting masks, then I think it's sending a message to other people around them that, something is happening, and that may not be the case. So we want to make sure that it's not causing alarm in the public. And what we want to make sure is that they're not coming, it's not interrupting the supply of these kinds of items within the hospital environments, within healthcare settings, where people actually really do need to use them.
Is it doing that right now?
At this point in time, we're definitely noticing that supplies are going down, or, the stock is going down, which means, and I can assure you, it's not because we're seeing a lot more respiratory virus infections in the hospital setting. And so likely it's people are driven by fear and wanting to protect themselves, is what we're kind of postulating. But that has not affected our inventory and our ability to protect our staff. We've been able to keep on top of that.
Okay, great. Thank you so much for that, Doctor.
So that doctor is very nicely explaining things like there's no reason to panic or fear, but there is reason, of course, to protect yourself for in any way you see fit. Essentially, how does it affect Canadian people? In Ontario, pardon me, there is one here that I was just looking at a moment ago. A man with coronavirus is discharged from the Toronto hospital. This is the exact clip. So, the man in his 50s was the first confirmed case of the new coronavirus in Canada. He and his wife, who was later confirmed to have the virus, recently traveled to Wuhan, China, which is the epicenter of the outbreak. So, his status continued to improve over the week, and he reached the point where he no longer required hospitalization, said Dr. Jerome Lees from Sunbrook. He will remain in isolation in his home. On Thursday, Ontario health officials says the man was recovering in hospital while his wife was doing well at home in isolation. Majority of patients we've seen do recover from this infection. That seems to be the case with a specific patient. So I'm not saying that it's not dangerous, but I think here with better medical infrastructure, we have a better chance of detecting it early and possibly isolating it and containing, let's call it the problem. So Ontario's Associate Chief Medical Officer of Health said 67 people have been tested for the virus in Ontario, according to YAFE. 38 tests came back negative, and 27 people who remain under observation are either at home in isolation or in the hospital. So, and then there have been 3 confirmed cases of the new coronavirus in the country, with BC confirming that a man in his 40s had the virus on Tuesday. Symptoms of the illness, according to Canada's chief medical officer, may take 2 weeks to manifest and are similar to those of the common flu. The symptoms include coughing, a fever, and a general feeling of malaise. Some people also have difficulty breathing. There's no specific treatment, but the research is ongoing. The man's treatment is really supportive, as it is for the most viral respiration infections. They monitored the man and offered anything he may have required, including fluids, blood work, radiographs, and oxygen, among other things. The death toll has reached more than 200 people in China, while thousands of others are sick. So, it affects Canadians, but it seems that the Canadians are doing a very good job so far in containing and isolating those that may be contagious and infected. Here's another play on of the original clip, the original post there. The Ontario health professionals are monitoring 27 people. My advice would be to do the same thing that the Americans are doing, which is essentially the U.S. is advised against all travel to China, and Delta and American Airlines suspend flights to China. Spokesman for the Chinese Foreign Ministry struck back on Friday at the U.S. travel advisory. I think Trump's policy of trying to at least mitigate the problem at its base, where people are traveling back and forth, that's not a bad plan. Of course, you hope and you want to identify those people that are traveling back and forth from the area that we know is let's call it the epicenter of the virus. We want to be as careful and thorough as we can, looking at travelers from those affected areas. American Airlines said that they were suspending flights from mainland China immediately through March 27. American and United will continue flights to Hong Kong. Delta and United said that they will suspend service on February 6. United said it expected to resume operations on March 28. Delta, which does not fly to Hong Kong, said it would suspend service through April 30th. Delta said in a statement that its flight to mainland China from the United States would depart on Monday, and that would be the last flight to the United States from mainland China, would leave on Wednesday. So, isolationism a little bit, just to try to contain and avoid further infection of the population. And I think if they see that through, and they're also extremely thorough and careful about passengers coming in, not to mention here, we have a far better medical infrastructure that would permit us to get infected to the hospital or even to their homes in isolation and observation, of course. So again, unfortunately, we don't have a vaccine or any means of a cure. But there was one other thing that I wanted to bring up. The vulnerable Canadian diplomats and dependents to depart from Beijing amid coronavirus outbreak. So passengers arriving on China Southern Airlines flight from Changsha in China are screened for new types of coronavirus. I wonder if that requires a blood test or not. In light of the spreading coronavirus outbreak, CITYNEWS has reported Global Affairs Canada has authorized the departure from China of selected diplomats and their dependents. So I presume that, staff with existing medical conditions, mental health concerns, the elderly, or other vulnerabilities, as well as all school-aged and younger children will be evacuated from the Chinese capital, Beijing. So, Global Affairs agrees to bring the people back. We are engaged with Chinese authorities in repatriating Canadians who are in China and concerned for their safety. It is a deliberate process in which we are engaged responsibly. We will have more to say on that coming days. Trudeau. So if he's serious about that, let's hope so, that those passengers will be screened upon arrival for the coronavirus and isolated and placed in medical care if necessary. Naturally, I hope that they're going to keep them on at least 2 weeks for observation, but I'm not a doctor, so I can hope only that these people are well prepared enough to receive those passengers when they arrive. 114 samples tested for the novel coronavirus in BC, only one positive so far. So it seems the Canadians are doing a fairly decent job so far in containing the virus and isolating and placing it under medical observation and care. So I think my fellow Canadians and Americans, anywhere around the world who's been affected by this, protect yourself by any means. Naturally, with me, the masks and so on, that's more effective for people who are already infected. And mask, I guess, can be helpful for your peace of mind if you feel that way. I'll just end this video with I want to say, protect yourself, protect your well-being and that of your family. The last time we had a virus such as this, a lot of people adopted a more guarded stance. No close contact, shaking hands, or close proximity with people, using the hand sanitizer cream. And of course, hand sanitizer is available at a lot of public, any public domain, you could say, malls, stores, anything like that. It used to be very common for people to be washing their hands and so on. So, I know there's a lot of cause for fear, but I urge people to behave wisely and use their common sense. So far as the outbreak is concerned, the model says 75,800 people could be infected in Wuhan as of the 25th of January. But that model is not yet credible, you could say. It's not based yet in facts. It's a hypothetical model, I believe. Could be infected. So I'll conclude the video there. I thank you for your time and attention, and I will be making subsequent videos about the coronavirus when there's more information to be had. Thank you for your attention. Thank you for watching. Bye-bye.